Transformational leadership, key to performance improvement. This presentation on transformational leadership will present a brief overview of how transformational leadership can be applied to the nursing profession to enhance performance in the workplace. It will also discuss why transformational leadership is relevant to nursing leadership, as well as explore what is written in literature. To provide structure to daily practice, we will take a closer look at theoretical implications and how nursing leaders can integrate this style of leadership into everyday practice. Lastly, transformational leadership benefits of practice enhancement will be delineated with performance improvement efforts. Performance management entails defining, monitoring, and identifying objective indicators of performance. It is a standard tool used by nurse leaders when making management decisions such as planning, budgeting, and evaluating performance measures. It is important for nurse leaders to implement performance management into their daily practice to keep associates accountable, align both associates and organizational goals, and mitigate deficiencies. There are 4 steps that guide nursing leaders to effectively implement performance management. The first step is having proper training and being equipped with the necessary skills to manage performance. This prepares nurse leaders to keep associates accountable while aligning the associates' expectations with the organization's mission, goals, and values. The second step to performance management is differentiating and rewarding high-performing associates while pruning low performers. Nurse leaders can do this while performing an associate's evaluation. Nurse leaders have the privilege to reward associates for their hard work and dedication, boosting job satisfaction, retention, and patient outcomes, to name a few. The third step in performance management is encouraging continuous feedback between nursing leaders and associates. During this process, nursing leaders can improve employee performance while guiding practice and role modeling behaviors that are aligned with the organization's vision and practice model. Associates are encouraged to give feedback to leaders as well, encouraging open communication. The fourth step to effective performance management is promptly addressing and resolving deficient performance to minimize potential risks to patients, colleagues, and the organization. With clear, concise, and constant communication, nurse leaders can set expectations and define the associate's role to avert poor performance. Transformational leadership is the gold standard of leadership and is central to nursing practice because it alleviates performance shortcomings by augmenting a number of measures such as patient safety, patient and staff satisfaction, and patient outcomes. In addition, transformational leadership transmits a strong vision to employees while encouraging critical thinking, increasing employee confidence, emphasizing the importance of performance, and inspiring employees through motivation, innovation, and intellectual stimulation. The main characteristics for transformational leadership is portrayed in a leader who is positive under pressure, forms connections with associates and colleagues, mentors and role models behavior, maintains a set core of values, motivates and inspires others, and is understanding. Furthermore, transformational leadership is necessary to help associates adapt to organizational changes while sharing the organization's vision and mission. In doing so, transformational leaders develop trust and foster strong relationships through active listening and demonstrating empathy. In turn, associates feel invested and valued by the organization, resulting in higher performance. Transformational leadership promotes effective performance by guiding employees through the complexities of the healthcare system. Due to the positive characteristics and attributes associated with transformational nurse leaders, the stage is set for leaders to build strong relationships through coaching, mentoring, and training, as well as fostering a positive work environment that revolves around trust, respect, collaboration, open communication, and problem solving. A positive work environment inspires employees to achieve organizational goals and promotes job satisfaction and performance which are linked to better patient outcomes. Transformational leadership is also relevant as nursing leaders work towards managing and improving performance measures to increase quality, safety, and contain cost. A review of the literature has indicated that transformational leadership is a valuable leadership style that can impact important outcomes within the healthcare environment, such as employee satisfaction, positive patient outcomes, positive work environment, improved performance measures, and organizational vitality. Nursing theory plays an integral part on the performance management process as well as the growth and development of employees. Imogen King's theory of goal attainment sets the foundation for 3 different systems that must find balance among one another for goals to be achieved. Those systems are comprised of the personal, interpersonal, and social system. These 3 systems are interrelated and constantly interacting with one another. To achieve optimal balance, transformational nurse leaders must know how to align each component's goal to achieve the greater good. With the advent of technology and multiple social media sites, King's theory offers solution to nurse leaders as they seek alternatives to align educating and motivating newer generations with the organization's mission and goals. Integrating transformational leadership into the healthcare environment has been readily accepted as its leadership characteristics support organizational performance and patient outcomes. Patient safety has been an ongoing dilemma, as highlighted in the Institute of Medicine's report To Err is Human. However, with transformational leadership being recognized by the American Nurses Association for its transformative qualities, it has been deemed a potential solution to patient safety. The nursing profession and healthcare system have benefited from the transformational leadership approach because it cultivates nurse empowerment and motivation. Leaders who utilize this approach can also inspire nurses to identify and pursue long-term goals that align with those of the organizations. As nurse leaders become more adept to their environment, they must remain able and willing to reevaluate practices and techniques that will assuage present and future challenges that affect multiple outcomes in healthcare, including safety, quality, efficiency, patient satisfaction, and cost. Nurse leaders need to start by creating a vision that excites, inspires, and attracts followers by continuously selling the vision and keeping it at the forefront of everyone's agenda. Transformational leaders connect the dots and know the direction they are headed and how to lead their team. They view failures as opportunities for advancement and welcome innovation and change to continuously improve performance. Transformational leadership will positively influence and enhance nursing practice and provide the following benefits: shared governance, staff empowerment and motivation, quality improvement, and the overall improvement of nursing practice. With shared governance, nurse leaders create an environment for nurses to practice with greater autonomy and at the top of their license while being responsible and accountable for their actions. It is also a vehicle for collaboration among interdisciplinary teams. Staff empowerment and motivation enhances communication and encourages positive behavior, improving quality and opening a vein for creative thinking. Overall, implementing these elements of transformational leadership adds value to the nursing practice. Integrating a Christian worldview and spiritual care into our day-to-day duties as nurse leaders requires that we use a holistic approach. When using spiritual care for patients, we have to remove ourselves as the inspiring force, and we must allow God to guide us. As Christian nurse leaders, we must treat each patient as a whole person. This includes praying for our patients, listening to them, asking questions, showing empathy and compassion, and giving them hope. God wants us to be His hands and feet to bring healing to those who are sick. In Matthew 7:12, the author encourages us to do unto others what we would have them do unto us. In conclusion, transformational leadership has been proven to have a positive impact on both the nursing staff and patients. To be effective in leading others confidently, literature supports incorporating transformational leadership into nurse leaders' daily work practice. Transformational leadership motivates both staff and the nurse leader and has been known to contribute to a positive and empowering work environment. Research by Krepia, Katsaragakis, Catalidou, and Presarakis note that the foundation for transformational leadership is built on the trust and respect employees have for their leader. It is this foundation that motivates them to perform at higher levels. Krepia and colleagues state, transformational leaders have charisma that make leaders act as role models, inspire motivation that empowers their subordinates, individualized consideration manifested by demonstrating respect, and intellectual stimulation by facing old challenges in new ways. It is evident that transformational leadership is one of the most prominent leadership styles recognized to not only enhance performance, but also to move healthcare reform in the right direction. Thank you for listening to this brief presentation, and we hope to have inspired you to consider transformational leadership to advance performance in your organization.